I'm Dr. Elona with Inspire Smiles. In this video, we will be sharing about TMD, which stands for Temporomandibular Joint Disorder, and causes, symptoms, and some diagnostic steps that we take towards identifying what the correct diagnosis is for you. So, temporomandibular joint disorder is the official name for the condition that most people call TMJ. So TMJ is not really a condition, that is just the name of the joint. It's called temporomandibular joint, which is basically a jaw joint. And the disorder is any imbalance within the chewing system. It's really not so much a joint disorder necessarily, which is comprised of teeth, ligaments, muscles, joint, and airway. So all of those components as well as airway, so 5 components as well, while the 6th one is the internal component. So those are all the components of what goes into this disorder potentially being something that becomes symptomatic. So it's a disorder which is a conglomerate of symptoms, and symptoms are the things that we feel, and then there's just multitude of those symptoms that could be diagnosed as temporomandibular joint disorder. I'm a specialist in diagnosing it correctly, also treating it non-invasively in an integrative manner, where we incorporate allopathic methods and also integrative medicine approach to treating the disorder, and also, most importantly, identifying the correct diagnosis for what we're treating, which is actually not something that's done most of the time. Most of the time, an eye guard is given to a patient, which is definitely not a solution, and it is part of the therapy to use the appliances. Although before correctly diagnosing what we're treating, we could not really initiate any treatment. So again, temporomandibular joint disorder is my specialty, and in the next video, we'll discuss the causes.